Good morning. This is Dr. Lisa in Tampa, Florida, with my daily update as we navigate the coronavirus, COVID-19 together on the front lines with a primary care practitioner in Tampa. I wanted to touch on something I find incredibly interesting about the virus and what we are seeing in the trends across the world, which is that men as a whole seem to be having much more significant chances of both dying but more severe complications from the virus than women do. So that is not something that we see typically with infectious etiology, where one sex seems to be so much more prone to having complications and outcome discrepancies. They're pulling data from all over the world, and in countries like Italy, I believe what they found is upwards of 60 to 70% of the rougher and deaths and much more ICU visits and respirator needs were slanted to the male population versus females. And in South Korea, where it seemed like more women were testing positive for the disease, there was still a 54-55% men that had higher fatality rates. So what that did for me was had me sit back and try to understand, what that could mean and how to apply it and help all of you as we navigate either preventing this from ever coming on board, or if we do get symptoms, helping us to remain in the mild, this is just a cold type category. So the first thing to think about is obviously hormonal. And we know that there may be some protective benefits of estrogen. Nobody is going to be able to answer this question until some of these clinical trials are completed and the data keeps rolling in and getting analyzed. But estrogen may have a slightly protective effect. I also read something interesting, which is the fact that since we know a lot of the severe reactions to COVID-19 are from an overactive immune system, that it may be women, because especially those who have had children, have had more exposure to foreign bodies, like having a baby, which isn't all your DNA inside of your body, which is very interesting. So maybe our immune systems are built just a little bit differently to not overreact to the same level that men do. We don't know this for sure. There are some more basic lifestyle things that I also find interesting, and that's really what I wanted to talk about the most in our brief connection here today, which is, in some of these Asian cultures, especially China, South Korea, and potentially Italy too, but I saw the data in China, that obviously there's a higher smoking incidence there, and it seems that men are more likely to smoke. But men are also more likely to just have lifestyles where they don't pay attention to symptoms. I see it in the practice all the time. They are, focused on career and taking care of the family, and they don't seek out medical care maybe the same level that women do. So for all of the men that are listening, this is really important, but for my women as well. If we don't understand why this is happening, and it may be things like lifestyle, which in another live we'll talk briefly about weight, the gut, food choices, those types of things, because they are also being related to the more profound reactions and outcomes that are on the bad side with patients that are not healthy. So if we talk about my patient population, when patients come in and I bring up just general care, self-care, getting outside, connecting to nature, doing meditations, I have a much easier time getting my women on board than my male patients. They feel like they are too busy. They've got to, take care of the family financially. When they get home, there's no time for self-care. And, we may find at the end of all of this that some of those thought patterns and lack of self-care could be why men are having worse outcomes. I wanted to give a tip along that line in more of my sort of spiritual causes of disease concept. So when you look in some energy medicine techniques, when they talk about the lungs, which is what we're all focused on with the COVID-19 pandemic, the lungs can be associated with unresolved grief. So I found that interesting because I think men, again, especially, are taught to suck it up and you don't need to cry, don't show your emotions more than women. We are gifted with the ability to be able to cry, for example. So what if we end up finding there's some type of tie there, that the lungs have unprocessed grief, and that when this sets in, it makes it harder for men. So I just wanted to throw that out and bring a energy biohacking tool tip for today from a breathing perspective in regards to the lungs, which is the Wim Hof method. And most of my biohacking buddies, patients will know of him. If you do not, he's also called the Iceman. So you can look him up. It's WMHOF. He has all the world records on doing crazy things like running marathons in negative-degree temperatures and holding his breath for insanely long periods of time. But he has a technique that anybody can do at home. So I want you to look up that technique and potentially try it today. It involves taking 30 very fast breaths, then blowing it all the way out and holding it for as long as you can. And then repeating this cycle. And I'm just summarizing it quickly because you can find it easily on YouTube. You just look it up. Doing that throughout for however many cycles you can, and maybe a couple of different times during the day. What that will do is awaken deeper parts of like lower levels of your lungs that maybe don't typically get utilized because you don't take deep enough breaths. So doing this technique plus just the box breathing that we talked about previously, or just deep belly breaths, will help activate your lungs so you have more reserve if something were to get in there. Meaning excessive mucus production, thicker mucus production related to COVID-19. So if you check out the Wim Hof method, try it. Let me know with some messages about what happens. You may get a little bit lightheaded, but that will pass. It will get easier each day. And getting that hyperoxygenation will also help kill viruses if there is any infectious etiology already present. So get breathing, and I'm going to leave you with the affirmation for today, which is, I breathe in peace and I release grief. So I breathe in peace and then take a nice deep breath, and I release any grief. And remember, grief does not have to be that you lost a loved one. Grief can be over a failed relationship, a failed business deal, missing your family that you're not able to see as often as you would like. So everybody today, breathe in peace, breathe out and release grief. Stay safe, stay healthy. Comments below, I will always try to get to all of them and address them on the next day. And thank you for joining me and being with me as we navigate this journey together. Bye, guys.